Hi, my name is Felipe. I'm a PhD student from RMIT University, and today I'm going to talk to you about a paper called Reviewing Indoor Environmental Quality of High-Rise Social Housing, which has been supervised by Professor Priya Rajagopalan and Dr. Maila Endemol. So to give you a little bit of context, there is 3.2 million people in Australia living under the poverty line. The social housing stock has shown a decline in the last decades. Near to the city center, many of the social houses are in the form of high-rise buildings, and people from social houses spend 75% of their time inside their homes, and the percentage is even higher for elderly and sick people. So we're going to talk about the four main factors affecting IQ, which are the thermal, also combined with ventilation, the acoustic, which is outdoor noise, air quality also affected with ventilation, which is indoor emissions or air pollution, and the lighting, which could be the artificial light or natural light. So the problem with these buildings in Melbourne is that due to their layout and configuration, they usually have like long corridors, and that means that many of the social houses are just single-sided facade. And due to the economic vulnerability, those units in social houses usually rely on passive systems instead of mechanical systems. And 58% of the social houses were built before the first building code was launched. So if we consider those issues and also these factors, we are going to probably agree that windows are a key element affecting IQ. And this gets more relevance now due to the pandemic situation, as homes have turned into multi-activity spaces. They are used now for working, studying, or even exercising. So an article has proposing that investment should be done in social housing, so we can have a reactivation on the economy through construction and employment, and we can tackle the stock decline of social housing, and of course we can reduce homelessness. So the objective of this research is to review the parameters affecting IQ, then explore the design standard that affects the social houses, and then focus on windows as one of the key elements. So why social housing? Because in terms of thermal, they have bad ventilation, they have inadequate heating, and they are also poorly insulated. In terms of acoustic, they are located close to the source of noise, which are the traffic networks. Residents are very sensitive to noise levels, and they have reported more exposure than other type of housings. In terms of air quality, they have poor levels due to bad ventilation also. Inner city houses have worse levels than suburban houses, and the indoor air quality is linked to the occupancy, which is higher in social houses, and also the activities, and social houses many times have people smoking inside. In terms of lighting, they have small windows, they don't have shading devices or balcony to control direct sunlight, and they have reported visual discomfort. So if we compare with this project in Denmark, they have bigger windows, some balconies to control direct sunlight, and the case in Melbourne is just small windows and no protections. So if these factors are not performing properly, then it can affect health. So if light is not good, you can have seasonal affective disorder. If the temperature is not adequate, you can have some respiratory infections. If you have too much noise, you can have some cardiovascular disease. And if the air quality is not good, you can have some sick building syndrome, among many others. So some of the findings is that in thermal, for example, the people with control over the windows have a more forgiving attitude towards the building performance. A study in Europe has shown that social houses, the average temperature is lower than the recommended values, and it's worrying that 5% of them are at freezing levels. And the impact of window sizes, there is some discrepancies, say if window sizes affect or not the heating demand in winter. And improvement in windows can be between 10 to 50% of thermal improvement. In terms of the acoustic, we can work on the transmission path or at the receiver. and acoustic barriers usually diffract the noise to the upper level, so it's not a good solution for high-rise building. And if we work at the receiver, then windows are the weakest element in the facade, but also the most cost-effective one. So changing from single glaze to double glaze, for example, it could work, but it's not really good for low frequencies. And the problem is that the traffic noise is actually on the low frequency range. And the problem is also that compliance is considered with closed windows, and there is a negative correlation between noise and ventilation, of course. And actually, not being able to open the windows is the most annoying aspect reported by occupants in noise studies. So some studies in indoor air quality, some study has mentioned that single side ventilation is better than cross ventilation. Is something worth exploring. And if we consider single side ventilation, then having two separate openings is actually better than have them centralized. And if we locate those openings in the leeward position, it's much better than in the windward position. So the problem with lighting is that it's really hard to assess because it has dynamic changes through the day, and also because of direct sunlight. And there are many metrics for that. So one of the most commonly used metric is the daylight factor, but the problem is it's not dynamic, and you can estimate the visual comfort. But many studies are recommending to use daylight autonomy, which is dynamic, and it can assess direct sunlight energy savings and also estimates the use of artificial light. The problem with direct sunlight if it's too much, can cause some glare and thermal discomfort. But a study is saying that the benefits can be achieved if they are between 15 to 25% of the floor area, and also suggesting that direct sunlight should be measured in terms of the amount of penetration rather than the time of exposure, which is usually the one used. In a study in Madrid is suggesting that in Madrid, which is similar latitude than Melbourne, but in the northern hemisphere, is suggesting that the window-to-wall ratio should be between around 20% for a 6-meter deep unit. And if we check in here in Melbourne, the percentage is probably between 10, no more than 15%, and many times they are deeper than 6 meters, so it should be actually more than 20%. So the better apartment design standards which are in place for social houses are actually recommending, for example, for thermal to have all the windows facing north, or most of them, but it's not always the best orientation, as some people is not comfortable with warm environments, and if we don't have any window lighting control, then it's going to be overheated. Cross ventilation is recommended for 40% of the building, but they don't mention any window size. They are just, the National Construction Code recommend 5% of window to floor ratio, and there is another 60% that is going to be single-sided, and probably with 5% of window to floor ratio, it could be poorly ventilated. And also, if that paper is correct that single-sided ventilation is better than cross ventilation, then this restriction shouldn't be considered. Then in terms of natural light, the National Construction Code states 10% of window to floor ratio, but papers have recommended that different orientation should have different window to floor ratio. In terms of the acoustic, they are suggesting no more than 35 decibels, but some disturbances have been reported over 30 decibels. And another issue is that they are measured with closed windows, and with passive buildings, it should be other considerations should be taking place. And so most of the assessment done in IQ are mostly in a single factor, and some of them are an holistic assessment, but the problem is that the thermal usually gets more relevance. So a properly weighting is something challenging because it also has subjective component and preference. And so there is a different idea of have like all the factors with equal importance, or have an expert of panels suggesting which is the different weighting for different factors. But the problem is that the subjective data could be biased. So in conclusion, the problems in social houses are that they have uncomfortable cross-seasonal temperatures. They are poorly ventilated. They have visual discomfort, and they have noise exposure. This condition can be worse for high-rise social houses due to the location and also the configuration and the building characteristics. And then it's worse for vulnerable population, sick and elderly, which is a big percentage in social houses. And the window type, size, and configuration have a direct impact on IEQ. There's some limited research on IEQ in social houses in the local context, and there is less information on an holistic approach on the IEQ factors. Thank you.